Good morning, ma'am. I am Pril Ashmakasayat. So, other than internal drug administration or giving drugs through the digestive tract, there's also what we call the parenteral drug administration or giving drugs through the injection or infusion. So today, I will be performing a record demonstration of preparing medications from an ampule, a vial, and I will be doing a parenteral drug administrations such as intramuscular and subcutaneous. So, prior to conducting the procedure, first, check the doctor's order. Okay, so this is done so that we will identify what kind of drug is to be given to the assigned patient. We have to determine the drug's name, the dosage, the frequency, the route of administration, and the time it is to be given. The next thing that we need to do is to check the label of the medication against the MAR of the patient. Now, in medication administration, it is important to perform the 3 checks of administering medication. First, we have to check or we have to read the label of the medication. Second, when it is taken from the medication cart. And lastly, we check it before and after withdrawing the medication. Now, we need to organize all the equipments that we will use so that we can avoid stopping during the procedure and also to consume time and energy. So the equipments that we have here are the alcohol, the cotton balls, an eggplant, a tissue. I have here a syringe, a 3 cc and 1 cc. I have a surgical tape, a vial, and an ampule. Also, I have here the alcohol pads. Okay, so now I'm going to proceed to the preparation of medication from a vial. So before I am doing that, I will be performing a hand hygiene. So if the medication is still reconstituted, then the vial would contain a powdered form of the medication and a diluent must be added into the vial. So in order to mix this, we will just rotate or rubbing the vial between the palms of our hands, not by shaking. So after that, I will ready my syringe. So I have here a 3 cc syringe. So since the syringe comes with a needle already, I am going to loosen it up first so that I can connect the barrel into the aspirating needle. And I'm going to connect. Now, ensure that the connection isn't loose. Set it down. And I have here an alcohol pad, or you can use a cotton ball soaked with an alcohol. I will remove the cup and aspirate. Now, I'm going to put the syringe into the vial. And then I'm going to invert, release the air. So if you see any bubbles, then you can just tap the barrel to expel the air bubbles. So since there are no bubbles anymore, then I can cap it. And set it down. But before doing that, I will remove the aspirating needle. And I will discard it into the waste receptacle. And I will change it with the right size needle. Make sure that the connection isn't loose. Okay, since we are done, I will set it down. So now, I am done with preparing the vial. I will now proceed in preparing an ampule. So this is what an ampule looks like. So I have a 1 cc syringe. So what I'm going to do, since the syringe has already a needle, what I'm going to do is to loosen it up first so that I can connect the barrel into the aspirating needle. Then I'm going to connect the barrel into the aspirating needle. Make sure that the connection between the barrel and the needle isn't loose. Okay, then set it down. So for an ampule, what we would want to do is to flick the stem of an ampule. But before doing that, I will wear gloves for safety purposes. Okay, so now I will put, or I will put an alcohol swab into the stem of the ampule. After that, flick the stem for a couple of times. And then I have here a cotton balls. I will put it at the top of an ampule. And remember, if you break the ampule, break it away from you and away from the people, just for caution. So now, okay, so since I already break the ampule, throw or discard the neck of an ampule. And then, put the medication into the syringe. Now I'm going to remove the aspirating needle and change it with a new needle size. Okay, since we are done preparing our vial and an ampule, we can now dispose our gloves. And perform hand hygiene. So now I am going to proceed with the subcutaneous injection. Okay, so subcutaneous injection is the introduction of the drug administration in the adipose tissue of the client. So first, perform hand washing or hand hygiene to deter or to prevent the spread of microorganisms. And then, what I'm going to do next is to check the MER. Okay, then I will go to the client's room and provides the privacy by closing the doors, windows, and curtains. Next thing that I am doing is to introduce myself and verify the clients using the agency protocol. So, good morning, ma'am. I am Priya Ashma Kasaet, and I will be your nursing student for today. How are you feeling? Okay, so you're good. So, ma'am, for verification, will it be okay to check your wristband? Okay, ma'am, may I know your full name? Your birthday? Thank you so much, ma'am. So today, ma'am, I am going to perform a subcutaneous injection to your shoulder. Okay? So now, before doing the procedure, I am going to assist the patient in a comfortable position. Okay? Now, after doing that, we will educate the client regarding on the medication that has been prescribed by the doctor. So, ma'am, today we'll be doing the administration of your insulin. So insulin will help your body to control your blood pressure since you have type 1 diabetes. Is that okay with you, ma'am?
Okay.
Okay, so before we proceed to the procedure, do you have any questions or clarification?
No.
None? Okay. So now, for subcutaneous injection, we still have to select the site that is free of lesion, tenderness, swelling, or any lesions. Perform hand hygiene and apply clean gloves. After doing that, we are going to clean the side of the hand. So the next step that we will need to do is to clean the site for the injection using an alcohol swab. Now, center going outwards for about 5 centimeters or 2 inches. Then I'm going to dispose the antiseptic swab. Now I have here the syringe. Make sure that the connection isn't loose before. Okay. So I have here now pinch. Okay. So now imagine that you're holding a dart. So what we are going to do is to insert the needle for about 45-degree angle insertion. So now, okay ma'am. Release the medication. Now, remove smoothly and put this up. Now dispose. So now, if bleeding occurs, then apply pressure with the use of dry sterile gauze or cotton balls. So ma'am, since we are done, okay ma'am, since we are done, how are you feeling?
Okay.
Okay, so good. So I'm going to head out now.
Yeah.
You may rest.
Okay.
And if you need anything, don't hesitate to call me using the call button, okay?
Okay.
So before we end this, do you have any questions or clarifications?
None.
None? Thank you so much, ma'am, for your time and cooperation, and have a nice day ahead. So after that, we need to do the aftercare. Remove the gloves. Dispose all the items. Perform hand hygiene. After that, I'm going to assess the effectiveness of the medication at time it is expected to act, and also document all the relevant information during the procedure. So now that we are done with our subcutaneous tissue, let's proceed to the intramuscular. Now, I am going to proceed to the intramuscular administration medication. So it is the introduction of the medication deep into the muscle tissue where there is a large network of blood vessels that can absorb the medication quickly. So after preparing the medication, head to the patient's room, provide privacy, security by closing the doors, windows, and adjusting the room temperature. Okay? So, good morning, ma'am. I am Puel Ashmakasaet, and I will be your nursing student for today, ma'am. How are you feeling?
Okay.
Okay. So, ma'am, for verification, will it be okay to check your wristband? Okay, so ma'am, may I know your full name?
Parenteral.
Your
July
birthday?
25.
Okay, thank you so much, ma'am. So today, I will be administering your medication that has been prescribed by your doctor. So ma'am, the drug name is cortisone. It is an anti-inflammatory which will help you with your tendinitis. Okay, ma'am?
Okay.
Okay, so I will be injecting the medication in your shoulder. Will that be alright?
Alright.
Okay, ma'am. Thank you. I'll just close the door so that no one will disturb us while we do this procedure. Okay? Now, after explaining to the procedure, we must assist the patient to the position. So, ma'am, please take your seat po. Okay. So, ma'am, what language would you prefer?
English.
Okay, so English. So, ma'am, this cortisone will help you to reduce pain and irritation. So, there are just temporary side effects like temporary increase of swelling, bruise, and pain at the injection site. But these are just temporarily, okay, ma'am?
Okay.
Okay. So now for intramuscular injection, we need to select a site that is free of skin lesion, tenderness, or localized inflammation. Now, if injections are to be frequent, alternate sites, and also the same sites that we need to be remembered is also should be the exact site for the injection. Now, apply gloves. Now apply alcohol soak with apply cotton ball soak with alcohol on the selected site. From circular outward for about 5 to centimeters or 2 inches. Then dispose. Next, prepare the syringe. Ensure that the connection isn't loose. Now, imagine that you are holding a pen, and then Okay, so the angle insertion for the intramuscular is 90-degree angle. So after that, pinch. Now, do not inject the medication quickly. You have to aspirate the needle for 5 to 10 seconds. If bleeding occurs, you can remove the syringe, dispose, and take a new medication. If blood does not occur, then you can just continue the medication. And since the blood is not occur, I will just continue the medication. Slowly, even pressure. Now, remove the needle smoothly and put this. Then, remember, it is not necessary to massage the area after the injection. So, dispose the used syringe, and I'm going to do next is to assess the patient. So ma'am, how are you feeling after the medication? Good. So ma'am, that's good. Since we are done, I'm going to let you have some rest now. I'm gonna head out now. If you need anything, just call me using the call button at the nurse's station, okay? So that I can come back anytime. So do you have any questions or clarification?
None.
None? Okay. So after that, dispose the syringe at the waste receptacles. Discard the used gloves. Perform the aftercare. And then, what I'm going to do next is to document the relevant information, the time of administration, any complaints or assessment of the client, and assess the effectiveness. Okay. Since we are done, thank you so much for watching. Thank you.